Hello boys and girls, I am Dr. Debapriya Banerjee, Senior Resident and Nodal Officer for Tuberculosis, Pulmonary Medicine of this institute. Now we will start with a tribute giving to Robert Koch, because he is the man who discovered Mycobacterium tuberculosis bacteria, and so we will start the day with paying a tribute to him. You know, I will talk in these following chapters: introduction, history, definition, epidemiology, pathogenesis, primary pulmonary tuberculosis, latent pulmonary tuberculosis, congenital tuberculosis, risk factors, and spread, mode of spread. Now, tuberculosis is one of the most prevalent infections of human beings and contributes considerably to illness and death around the world. It is spread by inhaling tiny droplets of saliva from the coughs or sneezes of an infected person. It is a slowly spreading chronic granulomatous bacterial infection characterized by gradual weight loss. TB is the world's second most common cause of death from infectious disease after HIV/AIDS. You know, one thing is peculiar, that when God created human being, He also created Mycobacterium tuberculosis and leprae, and possibly these two are the oldest infective disease for human being. Most possibly leprosy is the oldest, and then comes tuberculosis. And this tuberculosis has got many names over the centuries, even millennium. In the time of Aristotle, Hippocrates, all are known their time, everybody knows about the disease, but in different names. It was initially termed as consumption disease, phthisis, Pott's disease, white plague. At the time 460 before Christ, Hippocrates identifies the phthisis, Greek word meaning consumption, as the most widespread disease of the times, and notes that it's always almost fatal. Aristotle, 384 to 322 before Christ, believed phthisis to be contagious. That means it spread from man to man. Even though general opinion of the society was for the alternative theory that the disease was hereditary, that is, it is passing through genes from generation to generation. Until mid-1800, many believed TB was hereditary. In 1865, Jean Antonio Bellarmine proved that tuberculosis is contagious. And ultimately, in 1882, Robert Koch discovered Mycobacterium tuberculosis, the bacteria which causes this illness. And this Mycobacterium tuberculosis is otherwise named as Koch's disease, in the name of its discoverer, Robert Koch. I will show you this, the last a good picture. The hospital in Germany, an isolated tuberculosis hospital. About Robert Koch. Robert Koch was awarded the Nobel Prize in Medicine in 1905. In 1982, a century after Dr. Koch's announcement of the first World TB Day was sponsored by WHO and IUA TLD. There is International Union Against Tuberculosis and Lung Disease. World TB Day is held on March 24 each year in commemoration of Koch's discovery. Now, definition. It is a chronic bacterial infection caused by Mycobacterium tuberculosis that is characterized by the formation of granulomas in infected tissues and by cell-mediated hypersensitivity. The usual site of the disease is the lung, but other organs may also be involved. Almost all parts of the body is involved. Epidemiology. India is the highest TB burden country, accounting for more than 1/5 of the global incidence. The global incidence is nearly 9.4 million, and Indian annual incidence is 1.96 million. And you see the pie chart. Here India is about 21%. Next comes China, 14%, and next Indonesia, 6%. Epidemiologically, 1/3 of the world's total population has been infected with the tubercular bacillus. Annual incidence of new cases in global scenario is 5.9 million, 56% male, 3.5 million, 34% female, 1 million, 10% children, and people living with HIV, 1.2 million, that is about 11% of all new cases. In India, nearly 2 million new cases each year. And very sad to say that 3 lakh people die every year from tuberculosis in India. And you see the age relation in India. 0 to 14 years, it is about 2%. 15 to 34 years, it is about 43%. 35 to 54 years, it is about 36%. 55 to 66 years, it is about 11.24%. And 65 years and above, it is 6.63%. You note one thing here, that is between 15 to 54 years, most of the cases are happening here. And this is very important. Why I am asking you separately is that this is the productive year of a human being. And for the society, again, it is the most productive life of the workforce of a country is between roughly 20, 21 years to 50, 55 years. And most of the patients, if coming from the most available, capable and productive people, then the economy, the social demography, everything is to be suffered from one single disease. You have to remember this thing. Now, this is important for you to know throughout your life. All anti-tubercular drugs are Schedule H1 drugs and not to be dispensed without a valid prescription. Tuberculosis is a notifiable disease in India from May 2012. Non-notification became a penal offence since 2018 by Government of India. Notification is essential for both the government and private physicians. Where to notify TB cases? RNTCP, that is Revised National Tuberculosis Control Program, which has recently termed as National Tuberculosis Eradication Program, has an electronic TB notification system called NICSI, where all providers can register and notify cases in their name at this website. Now, we come to the most important thing, is the pathogenesis. That is how the disease is going to affect the human being and where it resides, how it occurs. Now first, a person is exposed to a source. Who is the source? Now the person who has got Mycobacterium tuberculosis bacillus in sputum. This is the main source. And inside that source, that bacteria along with some tissue or degraded material is aerosolized. An inhalation of bacteria, and that dies naturally by the immune system by that particular person in about 50% cases. When the bacteria reaches the lung, entire macrophages, about next 25 to 50% of the cases, bacteria multiplies inside the macrophages, and after considerable multiplication, there is start out necrosis, formation of granulomatous lesion begins to form. And that particular necrosis inside the parenchyma of the lung or any other tissue where the bacteria is lost is called caseous material. And from this caseous material, bacteria may go for 2 or 3 destinations. 1, the bacteria ceases to grow and lesion is calcified. It is about 95%. The lesion liquefies and it is spread by blood to different organs and result in disseminated tuberculosis, and mostly it is fatal and death occurs. Or the liquefies, after liquefaction, the bacteria comes out with the sputum and he is now a source. He may infect some other person. And that the bacteria ceases to grow, is calcified. Sometime it may be years after years, patient will remain in a good condition, but when his immunity is lessened due to some other reason or malnutrition like things, the bacteria may gain upper hand, and again there will be a reactivation of the bacteria, and they again start multiplying and cause disease. Now, who are the most persons to get the infection very easily? They are the risk factors for the tuberculosis. I have subdivided in 2 groups: underlying medical illness and socio-demographic factors. In medical illness, number 1 is HIV infection, and especially in our country, now we are seeing that diabetes is gaining upper hand. So you should remember, if a patient comes to you with cough, fever, for any duration, but with a history of diabetes, you should always go for sputum examination to at least eliminate Mycobacterium tuberculosis infection. Transplantation of organs, silicosis, any form of malignancy, gastrectomy, jejunal bypass surgery, chronic renal failure, malnutrition, and immunosuppressive and or corticosteroid maintenance treatment. Socio-demographic factors, I told you before that age 20 to 54 or 55 years is most vulnerable. Now here I like to say one or two things. Why the age group of 0 to 14 years is less likely to contract the disease? Because their contact with other people in their life is minimum compared to adult of say 30, 34, 35. He is to go for his livelihood. He is to come in contact with so many people that will never occur with a boy of 7 year or 10 year. Again you come to the extreme of age. After 60, everybody is more or less retired or semi-retired. Again, they are again coming in contact with less people, so there is less chance of contamination. And that is why age is a very important factor. Overcrowding. You know, in our country we are not able to containing this tuberculosis is overcrowding. In our bus, in our tram, in our taxi, in our auto, in our train, everywhere there is overcrowding. This overcrowding is one of the major reasons for contracting disease from your passenger standing next to you or sitting next to you. Next is homelessness. This homelessness is very difficult. They are staying here and there, they have got no permanent address, they have got no proper food, proper clothes, nothing. And they are coming with various people with various diseases and others. Correctional facilities and prisons, again they are overcrowding, and there are minimum facilities for treatment and personal hygiene. Next comes the intravenous drug abuse group. Usually they use a single hypodermic syringe to get the shot by all the friends of the group. That is, it may be 5 or 10 or even 15 or 2 or 3. And using this single hypodermic syringe may transmit infection from one person to another person. Abuse of alcohol, smoking. I would like to say smoking in two forms. That is, one in cigarettes or bidi, and other is cannabis or ganja. The smoking is very injurious to lung. It may again make the lung weak immunologically, and that I told you beforehand that calcified lesion of the tubercular infection may reactivate at this stage. Next comes, or beforehand I didn't tell you, that is immigration from endemic areas. Yes, immigration from endemic areas may be a source, and it becomes a risk factor both for him and for the other concerning peoples. Poverty, you know, poverty is one of the major reasons. Previously it was told that tuberculosis is a disease of the poor. But actually, you know, tuberculosis is not a disease of the poor. In ancient India, tuberculosis was called as Jakha, J-D-K-K-H-A, or you can write it J-A-K-K-H-A, Jakha. Or, important here, is Raj Rog. Now, what is Raj Rog? There is a disease which affects only the kings. In broad word, the moneyed man. Because previously there was practically no treatment for tuberculosis. For tuberculosis there were only two factors. By using those two factors you can get cured, or in absence of those two factors you will die. One is good food, highly nutritious food, which will give you herd immunity or which will increase your internal immunity to that extent where you can contain the disease. And second thing is clean and healthy environment. If you go through the old literatures, then you will see that there were a place told as, even now, health tourism or sports for healthy or health recovery. In older time it was Madhupur, Rajgir, in Bihar, or Nainital, in Uttarakhand, like places, where you can get a good, clean, pure environment that will help you recover the health. And that too was the only reason that it was called Raj Rog, because it cost money. But especially if you think otherwise, okay, yes, poverty is one of the major reasons, because poverty gives us various ill things which we got due to poverty. Number one, lack of personal hygiene, overcrowding, homelessness. Then comes malnutrition. Then comes some other bad habits, intoxication to the intoxicating drugs or substances like cannabis, alcohol, like things. All these things will lead to lowering of your immune system, and then the tubercular bacteria previously if you have got, then it will be reactivated, or you will be a good candidate to catch infection from the source when you come contact with him. Now you see this picture, I am showing you some picture of the bacillus. This is isolated bacillus, Mycobacterium tuberculosis. In short, we used to call him AFB, acid fast bacillus. This picture is seen in sputum, how it looks like. You see, it's a rod-like structure, stained red. It may be seen in isolated way or in clusters. You see here, lots of there. Why acid fast? Because after staining with carbolfuchsin, it cannot be washed out with the use of sulfuric acid. That is why it is called as acid fast bacillus. And usually you don't write in prescription test for sputum for acid Mycobacterium tuberculosis. We used to write what? We used to write sputum for AFB. Again I am showing you this, you see this is marked here, the plenty here. Now I will show you how it looks like in fluorescent microscope. In green background, it will see yellowish. I will show you very rare picture, and it is of this institution. You see here. Two Mycobacterium bacilli present in the pleural fluid, not in the sputum. These two are present in pleural fluid inside the macrophage. And this is a very rare picture, very rare picture. Now I will go through the tuberculosis, some types and some other primary facts about the tuberculosis. What is primary tuberculosis? It is first infection with Mycobacterium tuberculosis. I will use this abbreviation, MTB. Mycobacterium, T for tuberculosis, B for bacteria. So MTB lodges in alveolar macrophages. Bacillus proliferates and results in an inflammatory cell infiltrate reaching the lungs and the draining hilar lymph node. And there it causes granuloma. Granuloma is a central necrosis, central area of necrosis called caseation with epithelioid cells, Langerhans giant cells. Both are derived from macrophages. Some lymphocytes and a few fibrosis. Incubation period is usually 6 to 8 weeks. Now we will come to one good term, Ghon's focus. The necrotic area of the primary infection heals completely by calcification, but some of these calcified nodules continues MTB, which are contained by the immune system and hypoxic environment within the nodule and remains dormant for years. This, along with the area of hilar lymph node, is called Ghon's focus. In X-ray you will find a small calcified nodule in the lower part of upper lobe and upper part of lower lobe. A focus can also develop in regional drainage lymph node, and this whole thing, there is Ghon's focus and this regional lymph node, may constitute primary complex of Ranke. Now, what is latent tuberculosis? Majority of people infected by Mycobacterium tuberculosis is contained by their immune system, and the patient develops cell-mediated immune memory to the bacteria, and this is termed as latent tuberculosis. Majority of TB cases are due to reactivation of latent tuberculosis, which occurred many years ago. Diagnosis of latent TB infection, LTBI, depends on the demonstration of immune memory to the Mycobacterium proteins. You just compare what is the difference between a latent infection and active disease. Latent infection is usually bacillus in the Ghon's focus. In active disease, bacillus in sputum, granuloma, or infected organ. That is here presence of bacillus in the particular organ. That is important. And in latent infection, sputum smear is always negative. In active, sputum smear may be positive or mostly positive. Chest X-ray in latent infection may be normal. Active infection, chest X-ray shows cavity, consolidation or effusion. Latent infection is always asymptomatic. Active is always symptomatic. Latent infection is not infectious to other people, but active disease is always infectious to the other people through sputum. And congenital tuberculosis. What is congenital tuberculosis? Congenital tuberculosis is defined by Mycobacterium tuberculosis bacillus infection occurring in infant either during the intrauterine life or before complete passage through the birth canal. It is also a very rare disease with highest mortality. All over the world, only 300 cases have been reported till now. Out of them, only 10 in India. Now, tuberculosis spread. How the disease is spread? Tuberculosis is spread by mainly respiratory route. That is, it is spread by the cough, sneeze, which contains Mycobacterium tuberculosis bacilli in the form of droplets. And this form of droplets is very important. It is the tiniest form of droplets which gets entry in the lung alveoli. The medium-sized droplets will be rejected by the local defense mechanism of the nose, and the heavy droplets will drop down to the ground. It will not reach to other person. And one peculiar thing about the spread, the spread is mainly occurs at the evening time. It is said that Mycobacterium tuberculosis bacilli are very sensitive to ultraviolet rays. It gets less scope to infect some other person in the daytime due to presence of very high ultraviolet rays during the day. And now, other than lung, it affects almost all the organs of the body. If you start from up, then you will see the CNS, brain and meninges are infected, tonsil, middle ear, larynx, pharynx, both the lungs, pericardium, pleura. You come down to abdomen, liver, spleen, peritoneum, kidney, bladder, uterus, genitals, intestine, and lymph nodes anywhere in the body. If you consider in our country, most possibly after lung and pleura, this lymph node, intestinal and bone are the major constituents. Of all the TB cases, about 50 to 60% is of pulmonary. All other organs constitute rest 40 to 50%. Now, what is pulmonary? Now, the pulmonary tuberculosis occurring inside the pulmonary parenchyma is only called pulmonary tuberculosis. Others, even if inside the chest, like pleural cavity, the lymph nodes of the mediastinum is to be counted as non-pulmonary or extrapulmonary tuberculosis. Except lung parenchyma, tuberculosis occurring anywhere in the body is to be said as extrapulmonary tuberculosis. Now, I am telling you that this is the end of this class. Next day we will start with the clinical features and diagnosis. How to diagnose a case of tuberculosis? We will start with that. Thank you.